On this episode, we'll talk about how much weight can you really lose after gastric sleeve surgery.
3, 2, 1.
Here we go!
Hello everyone, I'm Dr. Álvarez with Endobariatric.com and welcome to another episode of our FAQ section. And boy, is this an FAQ. Yes, it is a very frequently asked question. How much weight can I expect to lose with gastric sleeve? And even though the answer varies by statistics and by studies, we can tell you nowadays that you are expected to lose at least 60 to 77% of your excess weight. Excess weight, which means that if you are 100 pounds overweight, you can expect to lose at least those 60 to 77%, 77 pounds out of those 100 pounds that you have overweight. And that is just a make-believe scenario where you have 100 pounds to lose. Can you lose more? Yes, actually you can. Our numbers here at Endobariatric are better than what literature says. So this has a lot to do on where you get surgery, what technique is used, and I also want to mention that the rate on how you're going to be losing that weight, you can expect that 60 to 77% of your excess weight to be gone in a matter of 12 to 18 months. All right, so you're not going to lose that 60, 77% on that first month or 2 months or 3 months. Nope, it's going to come off nice and steady. Can you lose more? Definitely. Normally men lose it quicker because men have more muscle mass and they lose more weight quicker. They metabolize quicker. Their metabolism is faster. So I'm sorry, ladies, that's nature. That's the way it goes. But it doesn't mean that women can't lose it. You will. Can you lose 100% out of your excess weight? Definitely. So there are a lot of factors that you have control over, and that is sticking to your doctor's guidelines. That is activity level. What's your activity level? How's your diet? How's your sugar intake? How's your carb intake? All these factors come into play. The more you follow your doctor's guidelines, the more you adhere to those suggestions, the more exercise, the more effort you put into those first 12 to 18 months, of course, the better outcome you will have. For a weight loss procedure to be considered successful, it could be, I'm noticing I'm saying a weight loss surgery procedure. I'm not saying just the gastric sleeve. It could be the gastric sleeve. It could be the lap band. It could be the gastric bypass. It could be whatever you decide. For a weight loss surgery procedure to be considered successful, patient needs to lose at least 50% of the excess weight. That is considered a good successful surgery. All right. So for the sleeve to have 60 to 77% literature levels, studies. Again, we have better numbers than those compared to injections, to medications, to the Ozempics, to the Mounjaro, to the Wegovy, which those have pretty much about 16 to 20, latest generations 24%. So it's not comparable. Weight loss surgery has its indications. Patients who need to lose 50, 60, 100 pounds, 120 pounds of weight loss surgery, of course, has a big impact and is very beneficial. So again, to summarize, you are expected to lose at least 60 to 77 by literature, depending on where you get your surgery, who crafts your surgery, if this is what they do for I mean, this is what we do for a living. This is what we do every single day. This is what our whole hospital is designed around and focuses on. And who does your surgery? How do you go by those guidelines? How are you following those directions or suggestions? How much activity level you have? Can you get to that 100? Yes, you can. 100% of that excess weight? Yes, definitely. I've seen it happen. So it all depends on a lot on the patient. But now you know what can you expect if you, in a make-believe situation that you need to lose 100 pounds or you have 100 pounds overweight, how much of those can you expect to lose with weight loss surgery, and specifically with the gastric sleeve? All right, so there you have it. I hope you found this information useful. If you did, if you can leave me one of these, I greatly appreciate it. And don't forget to subscribe to our channel. That way you don't miss out on any of our future episodes that we talk about gastric sleeve, weight loss in general, weight loss surgery. You don't want to miss out. I'm Dr. Álvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.